Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
You know, Tracy, we've made a lot of progress in treating cancer in the past couple of decades. Most cancers, that is. But there are some cancers that just seem to defy our best efforts and our latest treatments. And one of those is cancer of the ovary. Curing or managing ovarian cancer is often a challenge. In fact, the average survival rate for ovarian cancer is just 45%. Now, that means that less than half of patients survive 5 years following a diagnosis.
When you compare that to breast cancer, 90% of women survive 5 years. Prostate cancer, 100% survival.
Interesting.
Cancer of the colon and rectum, 67% of patients survive 5 years. So why is cancer of the ovary so difficult to treat? And is there hopes for better outcomes in the future? Joining us on the phone from Mayo Clinic in Scottsdale, Arizona, is gynecologic oncologist, or in lay terms, women's cancer specialist and surgeon, Dr. Kristina Butler. Dr. Butler, welcome to the program. It's nice to meet you.
Thank you so much for this opportunity.
Yeah,
Glad
you
to
bet,
be here.
Dr. Butler. So why is cancer of the ovary so difficult to treat?
Ovarian cancer is encountered at an advanced stage. The ovaries reside in the abdominal cavity and have great potential to become abnormal with difficulty in detecting their growth.
So symptoms can be pretty vague.
Symptoms are quite vague. These can be abdominal bloating, urinary urgency, abdominal pain. Very often these women don't present to a gynecologist, but perhaps an internist, a urologist. And having a heightened suspicion for these types of symptoms in women is just very important for detecting this type of cancer.
It seems like over the last 5 years, however, maybe the word is starting to get out about these vague symptoms that you should still pay attention to them and not just brush them under the carpet.
I absolutely agree and educate women frequently with that exact advice. It's very important to be attuned to your body and have an awareness of these symptoms. There's been great publication that women affected with ovary cancer have these vague symptoms over 30 times a month compared to women without cancer that have these types of symptoms maybe 3 or 4 times a month.
And the other problem, too, is that it's pretty rare, isn't it? I mean, we all know someone who has had cancer of the ovary, but compared to other cancers, cancer of the ovary is pretty rare, isn't it?
It is very rare, about 1.7% in general population, which accounts to about 1 in 73 women, so it's quite rare.
Any screening tests? I mean, we talked about the symptoms and how vague they are and how difficult it therefore is to make a diagnosis. Are there any screening tests that you can do to find women with ovarian cancer earlier?
I think the best screening is, again, being attentive to your body, and when something doesn't seem right, seeking evaluation. If nothing is found abnormal, continuing to seek evaluation and workup. We have best studied screening methods in high-risk populations. So if a woman's risk of ovary cancer is about 13 to 45%, screening does seem to provide benefit. However, for the general population, given that the risk or the rate of cancer is so low, screening doesn't seem to be available.
And who is at risk?
At-risk patients would be those perhaps with underlying genetic predisposition to ovary cancer.
That
For
would be like a
example,
family history?
Yeah, family history is very key, particularly first-degree relatives with ovarian cancer history. Also women with BRCA mutation or Lynch mutation testing.
I think part of the problem there, though, is how many women really know that they have the BRCA gene? I mean, there are not that many women who have been tested, are there?
I agree. So in general, we don't test women. You're exactly right. In some women diagnosed with breast cancer at an early age, this testing comes into play. Breast cancer is more common than ovarian cancer. But you're right. Most women don't know their mutation status.
If you have the unusual symptoms, then how do you go ahead and diagnose it?
Right. Once you hopefully suspect it, hopefully earlier rather than later, how do you nail down the diagnosis? How do you make a definitive diagnosis?
Yeah, so it all starts with a physical exam by a care provider, a physician perhaps, And this can also go in conjunction with a more thorough evaluation of the pelvis, which would be a pelvic ultrasound, providing a clear view of the ovary. The imaging may then lead to CAT scan, fuller evaluation of the abdominal cavity. And very often there are some simple blood tests we can use to help in the form of CA125. That's a tumor marker, also a tumor marker called HE4. And these can help kind of narrow down other possibilities and hone in on the diagnosis.
So if you have these blood tests available and you suspect a woman might have cancer because of some vague symptoms, can you do the blood test to help you determine that she might have ovarian cancer?
I think yes. If symptoms warrant further testing, absolutely imaging or blood testing would be very reasonable.
And then biopsy next?
Biopsy may be indicated, although is not always necessary.
All right. And
so
then,
you can sometimes tell definitively on the imaging study that it in fact is cancer.
That is true. And most patients, I would say, don't require a biopsy.
Okay.
What about treatment?
Yeah, so our best treatment for ovary cancer is combined therapy utilizing surgery hand in hand with chemotherapy.
Which do you do first?
It varies depending on the individual. In some instances, and I would say traditionally, surgery is first, followed by chemotherapy. However, we have newer science and individualized care, whereas at this point, many women begin with chemotherapy, then have surgery, and then have additional chemotherapy.
And can you give some of the chemotherapy into the abdomen and rather than all intravenous or systemic?
We do, and the ovarian cancers are very often confined to the abdominal cavity, which makes the abdominal chemotherapy regimen very effective because we can place the chemotherapy directly where the tumor cells are sitting in the abdominal cavity, thereby giving very high concentrations of treatment to the area of need.
Does ovarian cancer reoccur often if you can survive that treatment?
There is recurrence risk, particularly with advanced stage of diagnosis. So stage 3 and 4 patients are more often to recur later. However, if we're able to detect it at stage 1 or 2, the recurrence rates are far less.
Because of the combination of surgery and chemotherapy, are you improving your results, improving survival in these women?
So we have 3 beautiful randomized trials from the previous decades that have shown excellent survival advantage using the abdominal chemotherapy. More recently, we have some conflicting data with a trial that did not yield results as promising.
What about a blood test? Are you working on a new screening test that might make it possible to diagnose these women earlier?
We absolutely are. I would say countless hours are spent in the lab looking for biomarkers for early detection, anything we can do to detect it as soon as possible.
Is there any research that we should be excited about?
We are on cutting-edge investigations for an ovarian cancer vaccine, and in our phase 2 development of this with very promising outcomes. This vaccine is being studied in patients that have survived ovarian cancer with hopes that it will reduce recurrence and perhaps in the future hold a place for preventing initial diagnosis.
Well, we all think about a vaccine as preventing something. So it would work both to prevent the disease, hopefully in the future, but at the present time you use the vaccine to help prevent recurrence?
That is true.
And when you said phase 2, tell us what that means.
As we continue to investigate this vaccine therapy, we will lead to more advanced trials in the future.
Yeah, so right now you're using it in women who have been diagnosed and being treated with ovarian cancer to help prevent recurrence. But at some point in the future, hopefully you will have a vaccine to actually prevent ovarian cancer.
Very true.
That is exciting.
Yeah, no kidding. Cancer of the ovary, relatively rare, only 22,000 cases or so a year in the United States. It is often diagnosed late and the symptoms are vague. There is at the present time no good, reliable screening test, but Dr. Butler and her colleagues are certainly working on one. And it sounds like the survival is improving, but still, the majority of women die within 5 years of diagnosis.
Pay attention to those signs and symptoms.
But there is promise. New, better treatments are being developed, as we've just heard. Our thanks to women's cancer specialist and surgeon, Dr. Kristina Butler from the Mayo Clinic in Arizona. Dr. Butler, thanks so much for joining us.
Thank you.